so John is now on decompression therapy. As you can see, it's not a lot of pulling or jerking. It's very comfortable. He's feeling a pulling sensation in the back right here between the two belts. This is the upper body belt. We can either use a belt or there's an arm pad that go underneath the arms to hold you in place. This is the pelvic belt. It goes on nice and comfortable. You can remain fully clothed. And we hook up the belt to this pull head right up here. And when we look at the head, we can actually change the different pull patterns. These pull patterns have been studied and researched so that we can treat different parts of the body. One of the main parts of the body that we treat is the disc, but we can also treat joints like the facets, and we can treat muscle problems as well with the decompression therapy. Now while John is on the therapy, he feels a step-up pattern, and now it's actually pulling. We can set the pounds at whatever we feel is best for him and whatever's most comfortable. While he's on here, there's a phenomenon that occurs called imbibition. Imbibition is what happens in the discs when it acts as a sponge. So if you think of the disc as a sponge, every time it pulls, it opens up all those pores, and then it lets go, and it actually pushes and opens and closes the disc so that we can put nutrients into the disc. Because the disc has a poor nerve and blood supply, this is one of the best and most effective therapies, and this can actually keep John out of surgery if that is an option that he's thinking about. This is a wonderful, cost-effective, and non-invasive therapy that we can do to save surgery and give a lot of back relief to John.